Hi, I'm Dr. Blake Poland, and I'd like to talk to you today about community-based participatory research. I've been doing this for about 20 years, and I enjoy it a lot, and so I'm really happy to have this opportunity to share a few thoughts with you as you start to explore what CBPR is, which is the acronym that we use for community-based participatory research. It's probably a good idea to start with a definition, and one that's often cited in the literature, especially in the health field, is one from the Kellogg Foundation, and it goes something like this. Community-based participatory research in health is a collaborative approach to research that equitably involves all partners in the research process and recognizes the unique strengths that each brings. It begins with a research topic of importance to the community, with the aim of combining knowledge and action for social change, to improve community health and eliminate health inequalities and disparities. So there's a lot in that definition. Let's unpack it a little bit. I think it's important to start with the understanding that this is not so much a method as it is an orientation to research. You can use many different methods in a community-based participatory research project. Second, I think one of the phrases that's used a lot in this field that nicely summarizes the orientation is no research about us without us. There are, of course, several core elements to CBPR. The first, most obviously, is that it's participatory. So community is involved in every stage of the work, if they want to be, and that's a proviso I'm going to come back to in a moment. Secondly, it's cooperative, so there's joint contribution from community and from researchers. It's a co-learning process, so both groups are learning about each other and learning about the phenomenon that they're studying. And it has an explicit aim of building capacity in the community, capacity to engage in research, capacity to be informed consumers of research and co-producers of research. And last but not least, it's action-oriented. It's meant to make a difference and inform action on the ground. So, as you may have gathered, there's a fair bit of extra expectations to do this kind of work beyond the usual attention to rigor and quality in research. So why would we do CBPR? First of all, we are increasingly recognizing that to address the social determinants of health and health inequality requires collective action. It's not something we do as individuals. And therefore, affected communities need to be active collaborators in these change efforts. Secondly, health research is increasingly place-based and solutions-focused. So community input is essential to ensure both the relevance of that work and its uptake and utilization. Funders are also increasingly mandating the involvement of decision makers and communities in integrated knowledge translation and in other forms of research. And last but not least, communities themselves are demanding that we do this kind of work in a more participatory and involved way. So there's a few questions that need to be asked if you're undertaking your own CBPR project or if you're looking at someone else's work. And one of those is, how will the research serve the community? Not just in terms of the results that the research will produce, but in terms of capacity building, in terms of perhaps hiring research assistants and interviewers from the community and so forth. There are many ways in which research can benefit community. Secondly, we have to ask, how is the community involved in each of the various phases of the work? In defining the objectives of the research, in collecting the data, in the analysis of the data, in the framing of the findings, and in disseminating those findings, so who they go to, in what form, etc. And also we need to pay attention to what perceptions about the community are likely to be created or perpetuated through the research. Because many of the communities, especially marginalized communities that we work with, are stigmatized and stereotyped in society, and we want to make sure that our research doesn't perpetuate that. Stepping back a little bit, there's other questions we can ask about the context of the work and how it's undertaken. So for example, who participates, how, and on whose terms? So who's framing that? Secondly, what is the impact of gender, race, class, and culture on the way in which this work is understood and done, and who participates and who doesn't? Also, is the researcher an insider? Do they come from that community, or an outsider? And what impact does that have on the work? And I think we can also question, is more participation always better? One of the early studies I was involved in was with street youth. It was a harm reduction project, and I was very keen, having immersed myself in the CBPR literature, to go out there and really make sure this was fully participatory. And I discovered pretty quickly that the youth that were engaged in our project didn't want to have to slog through all of the data analysis and the writing up of results that we were hoping they would. And I came to understand that CBPR doesn't mean you make community be involved in all of those, but you make opportunities for them, and they select what feels right for them. Because for most community members, there's so much else going on in their lives. They're more interested in the results and the impact. Some want to learn about research, but often we have to let them decide what feels right for them. And last but not least, we have to balance rigor with issues of voice and representation. So we want people to tell their story in their own words, and we want as much as possible to come through in the results. But we also want to make sure that we have a balance of perspectives there, and that we're portraying the full spectrum of what we discovered through the research. So let me give you an example from a recent project that we just completed called the Transition Emerging Study. This was work funded by the Social Science and Humanities Research Council of Canada. It was led by myself and a team of social scientists from across the country, and we were looking at the emergence of the transition town movement in Canada. Now, the transition movement is one of several social movement responses to a series of emerging threats to health equity that include climate change, resource depletion, ecological degradation, economic insecurity, and widening socioeconomic gaps. What we did is we undertook a scan of the online presence of the movement. We did surveys with movement founders and members. We did interviews with people who were leading initiatives in different communities across the country, and we found about 100 communities that were engaged in this work in Canada. And we undertook a series of regional dialogues with movement leaders to better understand their lived experience of doing this work. And we finished at the end with a media scan of coverage in the media about the transition movement and local initiatives. So what kinds of CBPR elements did we build into this work? Well, first of all, as the lead researcher, I was also a bit of an insider, because I had been leading a local initiative for about 5 years prior to starting this research. So that gave me a certain understanding of what this work was before we even got off the ground, which really helped. It also meant that I was a bit of a known quantity in the community, so I wasn't just an unknown researcher coming in and making requests of their time. Second of all, we started right off the bat by constituting a movement advisory group of leaders in the movement from across the country, selected from different geographic areas. And it was chaired by one of them, and they provided key input at every phase of the work. And that was really instrumental and very helpful for us in some decisions where we weren't sure how things would be perceived within the movement, and we were able to check with them and also have their input in how the work was framed. Third, we made a commitment right from the get-go to release findings to the community before we pursued scholarly publication. So we did plain language 2-page flyers about the research on every phase as we completed it, and made that available to the movement through our website and Facebook page and through email. And we also did reports on our workshops that were just for participants, as well as ones that could be distributed more widely. Fourthly, we engaged, as I mentioned, in these dialogic workshops. These were 2-day weekend things that we organized in different parts of the country to bring movement leaders together in the third year of our project to reflect on some of the early findings that we had and to do an interesting process that we adapted from the structured story dialogue method from Ron Labonte and Joan Feather. And that involved peer-to-peer storytelling on some of the themes that were emerging from our work, peer facilitation of small group discussion that included some training by us in this methodology, and participatory analysis and theory making right there in the two-day workshop. So people were not only listening to each other's stories, but they were drawing out the implications of that for theory and practice together as a group. And then we, as I mentioned, produced reports both for those participants and ones that were, had less confidentiality issues that could be shared with their members and colleagues. We published this in a paper entitled Adaptation of a Structured Story Dialogue Method for Action Research with Social Movement Activists in the journal Action Research. And you can find that online if you'd like to learn a little bit more. But that's one example of how we tried to build CBPR principles and elements into a research study. So what did we learn from all of that? We learned that our initial stance as researchers and working with and for the movement mattered a lot. And so did the fact that the PI was an insider in the movement. We also learned that movement activists are interested in learning from and contributing to research, but their primary focus is really on the work that they're engaged in and in their own communities. So their available time and bandwidth for doing something more participatory was limited. We learned that it's very important to make the results available and accessible in a format that's easily digested and that's timely. So we're not waiting till the end of the study to share results of early phases of the work. And we learned that it's important to use research to enable conversations and connections within communities. So in the regional forums, the dialogic workshops that we created, we gave a half day to the movement to say, we've paid for you to come together from our research funds. We've very much appreciated what you've contributed to the research. Why don't you take this last portion of the weekend for yourselves to do whatever you want in terms of networking and building relationships and connections amongst yourselves. So that was another way in which we tried to give back to the movement. So just to summarize, CBPR is about working with people to make a difference. It's rewarding work if you're into that kind of thing. It requires a lot extra of the researcher and sometimes of the community as well, so it has its challenges on both sides. It requires a healthy dose of enthusiasm and patience and people skills and commitment, as well as reflexivity and a fair amount of flexibility to adjust on the fly. And it's important, I think, to let people self-select how much participation they want from their perspective. So I hope this has been helpful and that your future work in this area is rewarding, especially for the community. Just to close, I've pulled together some readings for further exploration if you're interested. There's two key texts in this field. One is entitled Community-Based Participatory Research for Health by Meredith Minkler and Nina Wallerstein, very well-known authors in this field. And the other is by Barbara Israel and colleagues, and it's entitled Methods in Community-Based Participatory Research for Health. So both books are health-oriented, and they're widely acknowledged to be the key texts in this field. There's a couple of other articles that might also interest you. One is by Sarah Flicker and colleagues on ethical dilemmas. There's an article that Jeffrey Nelson and myself and a few other colleagues put together around building capacity in community health action research. And it's more oriented to training, but there's a couple of key principles and orientations in there that you might find helpful. And I've also included Meredith Minkler's 2010 article on linking science and policy through community-based participatory research to eliminate health disparities. That's in the American Journal of Public Health, and it's a very good article. Again, you will have gathered here Meredith's Minkler's work is coming up a number of times as she's one of the key authors in CBPR in health. There's also another article by her and colleagues in 2008 on promoting environmental justice through community-based participatory research. Again, a very nice read in the Journal of Health Education and Behavior. So these are a few readings to get you started in this area. There's lots more, of course, after that, but I hope this has been helpful, and I wish you all the best in your exploration of this area. Thank you for watching.